This is Late Night Health. This is the radio show that cares about the most important part of your life, your health. During the next hour, the insane Daryl Wayne and I are going to explore a couple of issues that actually touch each and every one of us in one way or another. We're going to wrap up today and talk with Robert Clancy, as we do every week, and we'll be talking to him in about an hour from now. We'll also be speaking with our friend Christine Horner. Dr. Horner is an integrative medical specialist, and she'll be talking about ways of boosting our immune system to fight COVID-19. We're going to begin our show by speaking with Peter Bonkrude. He is the president of the Mosquito and Vector Control Association of California. And I believe, Peter, you're also a director in one of the local chapters of that association?
That's correct. I'm the manager of Shasta Mosquito and Vector Control, so in Shasta County. I'll be the one that does the mosquito and vector control in our area.
Does every area in California have a mosquito control something?
There's pretty good coverage. I wouldn't say every county has a specific special district like we are, but everybody does have coverage through the California Department of Public Health. There's a vector-borne disease section, and they can provide assistance and support in those counties that don't have a local agency like ours.
I guess the topic that struck me is that can mosquitoes carry COVID-19? And what is the answer to that?
Well, the best answer, and unfortunately it's the scientist answer, is based on the best available information, we don't think that mosquitoes can transmit COVID-19. Being a very new disease, obviously, we don't know everything, but we have a pretty good record of knowing how mosquitoes transmit diseases and what diseases they can transmit better than others. And so there's a high probability that mosquitoes cannot and will not transmit COVID-19.
Yet there are some health issues with mosquitoes still. I'm thinking of Zika and some other viruses that they do carry. Do we have a problem here in California as well as throughout the United States?
Yeah, I think in general mosquitoes are obviously a concern, not only from a nuisance standpoint, but obviously from a disease transmission standpoint. In California, West Nile virus is still the main focus. We still have quite a few cases of West Nile virus every year. We still find that it's transmitting pretty regularly within our populations, and overall that's our main focus. Some of the newer diseases that we were looking at, you mentioned Zika virus. Dengue is also one that there is a concern kind of moving into the United States, and chikungunya as well. Those mosquitoes that transmit those specific diseases aren't everywhere in California, but they are in several counties, and they are growing in terms of their habitats and where they can be. And so we're seeing an expansion of the potential for those diseases to be transmitted.
I know that I live near I don't know what you'd call it, that little park area behind my house, Daryl, about a block over?
Yeah, it's a park.
It's a park, but there is you can't get into it. It's cordoned off.
Yeah,
there is water. Yeah. We walk over and look at the ducks a lot. It's pretty nice to see, but there are mosquitoes around. I know there are, because whenever I walk outside, they say, "All right, Mark's out. Let's go get him."
There's always going to be mosquitoes. For the most part, our efforts are to try to lower their levels to healthful levels where they aren't transmitting disease. But there's a lot of personal protection that we need people to take on themselves in order to make their control and their ability to not get bit higher. Wearing an EPA-registered mosquito repellent or insect repellent, dressing in long sleeves or pants if you can, especially when mosquitoes are going to be their most active, which is typically around dawn and dusk. checking the windows around your homes, getting rid of any standing water that you can around your property, reporting any standing water that you see. All those things can go a long way to keeping you from getting bit.
I know that there's some controversy about DEET. There may be some controversy about DEET. I think it's been tagged as potentially carcinogenic. And so there's a lot of natural products, oil of lemon, eucalyptus are just a couple of those that can do it. I've always thought that we should release in standing water, guppies, because they love mosquito larvae. Is that still are they doing that or not as much?
Yeah, a couple things to hit up there. So far, there isn't a well-documented issue associated with DEET. In fact, it's one of the few repellents that is approved to fairly young ages for children. So I want to make sure that that's made aware that DEET is still a very safe and effective mosquito repellent. You also mentioned oil, lemon, eucalyptus. Agreed. That's also an EPA approved repellent. There's also IR 3535 and picaridin. All four of those are shown to be effective for insect repellents, and so we definitely want people to use something that's been proven not only effective but safe for use. So, obviously you can go to our website, mbcac.org, or you can go to CDC or EPA, and they're going to list all those insect repellents and kind of the different recommendations associated with each one, because they're all a little bit different. But please find one that works for you and use it regularly. In terms of mosquito fish and or other biological organisms, yeah, they still are pretty widely used in California. I mean, every location is going to have slight different, whether it's guppies or what we term the mosquito fish, Gambusia affinis. They are appropriate for certain habitats, and they do really well at dealing with the immature mosquitoes, the larval mosquitoes, or their pupal mosquitoes. So that's a good biological control that pretty much all districts utilize, in lieu of some of the other control strategies that we have.
Right. Frogs. I always think of a frog and their tongue going, rivet and grabbing them. Do mosquitoes have any?
Frogs aren't effective mosquito control. They don't really preferentially feed on either immature or adult mosquitoes, so they've never been really harnessed as a biological control tool.
All right, so we have to go back to those guppies. Do mosquitoes themselves, Peter, have any environmental good that they do? Or should we eradicate the little buggers?
Well, I think eradication is impossible, frankly, at least with the types of strategies that we're currently using. To your point as to whether there's a value to them, yes, everything that is part of our ecosystem has a value. There's nothing that we're aware of that specifically feeds on mosquitoes solely. They're normally just kind of a part of the natural biota that is getting fed on by a variety of generalist predators. So, yes, they are part of a lot of diets of a lot of different animals, insects, but there's nothing that specifically feeds on mosquitoes. So reducing the amounts typically doesn't have an impact on the overall ecosystem in that area.
And the best thing is then to keep standing water away. I mean, dry it up, clear it up, from fountains and watering outdoor plants in pots. Make sure that there's not a lot of standing water, because mosquitoes can live in just about any amount of water. If somebody is interested in finding out more about the Mosquito and Vector Control Association of California and their own association, is there a website that you can give us?
Sure. If they go to www.mbcac, so that's mvcac.org, or just Google Mosquito Vector California, they should find them. And then within that website, there's actually an address listing map where they can figure out what their local mosquito district is.
Terrific. Peter, I'm sorry, we're out of time. I'm getting the wrap-up signal for this segment. Peter Bonkrude, president of the Mosquito and Vector Control Association of California. here on Late Night Health. I'm Mark Alyn, along with the insane Daryl Wayne. Don't go away. More coming up. Recently, I met Jacqueline from Bright here in Los Angeles. She gave me a hearing exam and then showed me how to hear again with the new Signia Pure Series hearing aids, and she can give you your life back too. I hear birds chirping, birds cooing, and even my wife. They easily connect to my smartphone. The Signia hearing aids are amazing, and with the charge and go, I don't have to fiddle with batteries and hear all day long. Not hearing is frustrating for you and your family. I know you don't have a problem, but trust me, call Bright Here now for a free hearing exam, a $125 value, yours free, just for making an appointment now. There are offices throughout the Los Angeles area. Call Bright Here now at 323-424-7100. That's 323-424-7100 for a free hearing exam. There's no obligation. Call now, 323-424-7100, or visit them on the web at brighthere.com.
If you're listening to Late Night Health right now, you're part of the growing target of baby boomers we're serving. Hi, I'm Daryl Wayne, producer of Late Night Health, inviting you to join the Late Night Health family. If you have any business targeting the growing boomer market, Late Night Health is the ideal advertising vehicle for you. From vitamins to insurance, alternative health to Western-style medicine, Late Night Health caters to the growing population of those over 40 years old. This vibrant demographic has expendable income to fight aging, purchase travel, take care of aging parents, or just have fun. Find out about the advertising opportunities with Late Night Health. Call us at 805-391-0308. That's 805-391-0308, or email us at info@latenighthealth.com. That's info@latenighthealth.com. Join Late Night Health as we empower people to take charge of their own health care. Call now at 805-391-0308. That's 805-391-0308.
There's a lot of talk all over the internet about the remarkable benefits of Carbon-60, and baby boomers are especially excited about it. Greska's Carbon-60 is the premium Carbon-60, developed by an aerospace and NASA scientist. 95% of Greska's customers report positive results from this Nobel Prize-winning technology in just 4 days. Imagine more energy, better health, and more vitality. It's very bioavailable to quickly mend toxin-crippled cells. This is a super powerful antioxidant. Bob Greska is so confident that you'll love his Carbon-60, he wants to send you a bottle at 50% off the regular price to see how life-changing this will be for you. Call 720-600-6040. That's 720-600-6040. Visit c-60.com to learn more. Call 720-600-6040 now, or visit c-60.com. Late Night Health continues. I'm Mark Alyn, along with the insane Daryl Wayne. We're going to be talking with Josh Lane from Here's to Your Health as well during this segment. If you want to ask us any questions, you can always write to us at info@latenighthealth.com. I personally answer all of those questions, info@latenighthealth.com, and you can visit us at latenighthealth.com. Latenighthealth.com is the place to be, because there's lots of information, lots of things going on that website. And there's Facebook. You can find us at LinkedIn and more. And, of course, podcasting systems and networks all over the place. I got up this morning and we had a few minutes that I had planned just to talk about some thoughts. I mean, being at home for now 4+ months is really starting to wear on me. I need to get out. I'm a social animal, and using Skype and video conferencing of one kind or another is just not the same as being in studio with Daryl. Daryl is in studio at his studio. I'm in my studio in different parts of Ventura County. And I'm not encouraging meeting people, but at the same time, I have a business to run, and mentally, I like being with people physically. So it is a challenge to me. And so a couple of things. Gary Stewart, who's been on the show a number of times, been researching COVID, came up with a study that shows that some countries are suggesting that people take vitamin D supplementation, that it's been shown to reduce the effects of COVID-19. Now, I've always taken vitamin D. I have increased in the last couple of weeks my intake. I'm not a doctor, so I'm not going to make any recommendations. When we talk to Christine Horner later in this episode, we'll ask her about vitamin D. But it's interesting to me that a simple, inexpensive supplement has a good chance of reducing the effects of COVID, saving lives. And as I said, it's not inexpensive. It's cheap. Vitamin D3 is cheap. So we'll find out more about that. Also, I have a listing of the 50 states, the top 10 states out of the 51, because 51 is a District of Columbia, the states with the fewest restrictions and the states with the most restrictions. The biggest change happened in the state of Oklahoma. Oklahoma was ranked number 34, which is not bad as having restrictions. Since they have lowered the restrictions, removed many of them, they've moved up to number 9 in the states with the fewest restrictions. They've lifted travel restrictions, eased those. They've lifted all large-scale gathering restrictions. We could see that on Saturday night with 10,000 plus people meeting the president in Oklahoma. And mandatory stay-at-home restrictions have been eased and lifted. They went from 34 to number 9. And it's also interesting that in the last week or so, as restrictions have eased, as people have moved out trying to normalize their lives, they've, they have, we have seen the incidence of COVID-19 numbers go up. Are we lifting these restrictions too soon? I have to say, I think they are. I think we should have hunkered down a little bit longer. I'm going to go to Daryl, my friend and my buddy and my partner on Late Night Health. Do you think we're opening the Pandora's box too soon, Daryl?
Well, it's a balancing act. And right now, I think that it depends on how much you honor your health and the health of your family and the health of others outside. Because they still say that you can be, innate as far as the disease is concerned and be a carrier for it. And, no matter how hard you try to do some physical spacing, no matter how many masks you have, no matter what the situation is outside your very own home, you could run across something that is unexpected. You maintain the 6 feet, somebody else doesn't. They go, they cough, they walk by, you have an inadequate mask. It's all over. You bring it to friends and family. So I really,
right.
At this point, I think that anything that is not obeying the big 3 rules, the social spacing, the wearing a mask, and having no temperature, if you pass all 3 of those, it may be okay, but nobody's doing that. Right? You looked at the Trump rally. Everybody was sitting elbow to elbow in that auditorium. There was no spacing.
Very few people had masks.
Yeah. I went to a record store over the weekend, as I oftentimes do, and they were only letting 20 people at a time into this huge building. They weren't taking temperature, but they were checking for masks, and they were if people were getting too close together standing at any of the displays in the store, they were physically asking them to separate themselves and move back, right? Because the most important thing that I thought was happening was in the stores to have the lanes one way, right? Whether it be Walmart, whether it be your local grocery store, one way. You can only go down the aisle this way and go back. Nobody was paying attention to that. Nobody was paying attention to that. And I thought that was, genius as far as I'm concerned.
Yeah, but I'm dumb. I don't look down. I didn't look down. And I'm walking down an aisle looking for something in the market.
Oh, come on. It was Trader Joe's. We know it was Trader Joe's. You can say it.
Actually, my Trader Joe's doesn't have that. I think it was Walmart. I think it was at Walmart. And I was walking down, and it was, I couldn't figure that. I dawned on me I was doing it wrong.
It's a roll of the dice.
I'm sorry?
It's a roll of the dice.
It is.
Yeah.
Josh Lane from Here's to Your Health. How about you? Are you wearing masks? Do you think that the masks are effective?
Well, the masks are required here in California, so I wear it. It's not as much fun to shop with wearing a mask, but I wear a mask. I also, like you, I take vitamin D. I use 5,000 IUs a day. I think it's a good idea. I think vitamin C is a very good idea. I'm not saying use the cures. I think it's good ideas. I also use lysine as an antiviral. And also, don't laugh at this, I eat onions and garlic, which I think are actually very good for us. And of course, covering your mouth, and washing your hands, all very nice ideas. I'm just hoping that the statistics that we were given at first, I think it was a British researcher said millions of people are going to get sick with COVID-19 and millions more. And it turns out his numbers were incorrect. And so we put all these ideas into place. I'm hoping they're actually important ideas. I'm hoping that they are correct. And also I can throw this in too. When people get sick with COVID-19 in the hospitals, when the hospitals diagnose the illness or the death rather as COVID-19, they are paid $13,000. So there is a financial incentive to say that everything that comes in there, if a person gets hit by a bus and they also have COVID-19 in the bloodstream, they say, oh, they died of COVID-19. So I'm not a conspiracy theory guy, just not what I am. But it seems to me that I'm not sure the numbers are accurate. That's all.
So you're a little paranoid about the numbers.
No, I wouldn't say I'm paranoid. I'm just concerned that the numbers are not accurate.
Realistic.
Because the testing seems to be inaccurate. I mean, some people say the tests are 30% wrong. Some people say they're 50% wrong. Some people say they're 80% wrong. So I just don't know, how the numbers are being given. And again, because of the financial incentive on the part of the hospitals to have any death recorded as a COVID-19, possibly that's skewing the numbers. I'm not saying it is. I'm saying it's a possibility.
Got it. And that makes sense. I understand that. I'm wearing a mask out. I'm limiting my contact with people. I miss hugging Daryl. Well, okay, sometimes. And I think that I want this to go away, and I want it to go away tomorrow. I want us to get back to normal, but I don't think it's going to happen. I don't think it's going to happen for years.
There's some things for next year that are being put off that were scheduled at the beginning of next year. So
yeah,
I'm certainly expecting it to be here then.
And sporting events. I mean, have you seen? There was a game show with Jimmy Kimmel, How to Be a Millionaire. It's terrible because there's no audience. All right, we got to go. This is Late Night Health. I'm Mark Alyn, along with the insane Daryl Wayne.
The latest from the greatest, the best in new music by classic rockers, with your host, the insane Daryl Wayne.
This is Alice Cooper, and if Daryl Wayne is insane, what does that make me? Criminally insane. Stick around to find out.
Many of the artist interviews for the latest from the greatest have been captured on audiobook. There is a Volume 1 and Volume 2. Great information and conversations with people in the industry and people surrounded by the industry, and of course the rock stars themselves.
I'm the Reverend Al Green, and you're listening to the insane Daryl Wayne. And I said Wayne Insane.
You can find it on Amazon or Blackstone Audio. Search for the latest from the greatest from Daryl Wayne, Darrell Wayne.
Hello, this is Weird Al Yankovic, and you're listening to the insane Daryl Wayne, aren't you?